In exercise 11, we're looking at articulations and body movements. Articulations are joints. It's what's helping to hold the bones together. It's allowing for movement and flexibility of the skeletal system. We have two different ways of classifying them. They can be classified either by structure or by function. If we look at the functional classification, they will be classified depending on how much movement is allowed at that joint. So synarthrosis are joints that are immovable, amphiarthrosis are slightly movable, and diarthrosis are freely movable joints. If we classify according to the structure, it has to do with the type of tissue that's between the bones of the joint involved. There's three different types. You can have fibrous, so the bones are going to be connected by dense regular connective tissue. There is no joint cavity that is present there. Cartilaginous joints, the bones are going to be joined by cartilage. Once again, there is no joint cavity present. And then synovial joints, the bones are covered by articular cartilage. They are separated by a joint cavity. They're enclosed in an articular capsule that has synovial membrane there. And synovial fluid that's going to help be reducing friction there. If we look a little bit more detail at fibrous joints, there are different types. You have the suture. These are immovable. These are only found in the skull. Syndesmosis are slightly movable. The movement is going to be limited, such as between the tibia and the fibula. And gomphosis are immovable. This is the joint between your permanent teeth and either the mandible or the maxilla. So hopefully those are immovable. Cartilaginous joints, your synchondrosis have hyaline cartilage. They're immovable. It allows for growth. You see this at like the epiphyseal plate and the long bone where the growth is occurring. And symphysis, fibrocartilage, slightly movable. You'll see this in the intervertebral disc. Kind of acts like a shock absorber. Your synovial joints, the most common type of joint, does allow for a lot of movement. Depending on the type of movement, you can classify them as one of 6 types within the synovial joint. So all of these are synovial joints. You have the plane, the hinge, pivot, condylar, saddle, and ball and socket. If we look at the synovial joints, there are several different components of it. You do have the articular cavity. That's a space that's between the bones, and it's going to be filled with synovial fluid. What is synovial fluid? It's a very viscous type of fluid. It acts as a lubricant, so it's going to help reduce friction. The articular cartilage, this is the hyaline cartilage that is covering the ends of the bones that are involved in that joint. The articular capsule, there's 2 layers that it encloses the cavity. The external layer is going to be fibrous, and the internal layer is the synovial membrane itself. Ligaments, typically you will have ligaments that are outside the capsule, and then you may also have some ligaments that are intracapsular that are within the articular capsule. The articular disc, these are pads. They're known as menisci. They're also going to be helping, kind of acting as shock absorbers. And then you can also have bursae. These are sacs. They're filled with synovial fluid. They are usually located where a tendon is crossing a bone. Remember, ligament is attaching bone to bone. Tendon attaches muscle to bone. So where that tendon is crossing over the bone, typically underneath it, so between the bone and the tendon will be a bursa to help reduce friction. Helps reduce rubbing of the bone. So if we look at the knee, you can see here, let's see if we can, over here, this green area, I highlight this area right here, you can see that it is pointing to a bursa. There's another one right here because you have a tendon that is running right up here from the muscle up here to the patella, and so you want to have a cushion between it and the bone, and that's what the bursa is acting as. Here you can see some of the ligaments, and then over here this is a meniscus. From this diagram here, you can see the meniscus right here, the lateral and then the medial. It's also acting as a cushion between your bones here. This is the ACL, which many of you may be familiar with, especially if you play sports. And here is your posterior cruciate ligament in the back. Notice they cross over. You have ligaments out on the side that are helping to stabilize the knee. So these would be extra capsular, and these would be intra. Here is the patella and the location, as you can see, of the bones. You do have all of these ligaments here to help with attaching the bone, remember, bone to bone, but it's helping to stabilize this joint and yet allowing the different types of movements. So when you look at the specific types of the synovial joints, gliding, it just depends on the type of movement that you get. And this is going through some examples of where you may find these gliding joints, such as the sternoclavicle joints, hinge joints like the elbow or the knee, pivot joints, ellipsoidal joints, saddle joints, and ball and socket. So the joints you have movement. Well, of course, we're going to give names to the different types of movement that you see there. And usually the movements are going to be paired, because if you have movement going in one direction, you can also have it going in the opposite direction. So you'll notice they're always paired up. We're going to go through some of these. Flexion and extension. So flexion is going to be a type of movement where you're decreasing the angle of the joint. It's reducing the distance between the two bones. Extension is going to be the reverse of that, where you're increasing the angle of the joint and you're increasing the distance between the two joints. So they're opposite of each other. And this is just showing examples of excuse me, this type of movement. You can have hyperextension where you would go beyond that midline point. Now, extension and flexion, we do give different names when dealing with the foot. We'll talk about that in just a moment. Abduction and adduction is with the limb, so the arms and the legs only, and the movement away from the midline or towards the midline. So with abduction, think you're taking away, you're moving away from that midline. Adduction, you're adding back to it. Rotation is the movement of the bone along the longitudinal axis. Is very common in ball and socket type of joints. In circumduction, it's a combination. You're kind of doing flexion, extension, abduction, and adduction all together at once. So abduction, we are moving, if I can find a color maybe, we are doing a movement. Abduction is like you are taking and it doesn't want to show the color, but you're moving away from the body. Adduction, you're adding it back in. And then circumduction, you keep the arm straight and you just move it around like this. Pronation and supination has to do with the palm of the hand and how you are moving it. Supination, you're moving the palm from a posterior position to an anterior position, so you're moving it back into anatomical position. Pronation is the reverse, so you're moving it from the anatomical position to facing in the back. So in the upper picture it is showing supination versus pronation. Movement of the foot, and B is showing inversion versus eversion. How are you moving the palm, or the sole of the foot, and then protraction and retraction is with the jaw, the mandible, and the movement of that. Elevation versus depression, once again, it's showing it with the mandible, lifting up, lifting down, and then opposition is with the fingers. So this goes through the descriptions with the foot, and as we mentioned earlier, dorsiflexion is moving the ankle in a dorsal direction, like standing on one's heels. Plantar flexion is standing on the toes or pointing the toes. There are several different types of disorders that can occur with the joints. Dislocation is when the bones, two bones in that joint, they're no longer aligned properly, and so you have to put them back in alignment. They may not be broken, but they're not properly connected the way they should be. What is the difference between a sprain and a strain? Technically, a sprain is when you have damage to a ligament. Remember, ligaments are joining bone to bone. Now this damage can be that it's either pulled or it could be actually torn. A strain is when you have damage to a muscle or the tendon. And remember, a tendon is connecting the muscle to the bone.